As a weight loss doctor, I talk to patients every day who are curious but also terrified about starting GLP-1 medications like Ozempic, Wegovy, Zepbound, or Mounjaro. Maybe you've heard scary stories about nausea, loose skin, or weight regain. Maybe you're nervous about the injection or worried you'll have to take it forever. You are not alone. These are some of the fears I hear from real people, fears that could easily stop you from even starting your weight loss journey. Hi, welcome if you're new here. I'm Dr. Bazgha Khalid. I'm board certified internal medicine and obesity medicine doctor. And I prescribe GLP-1 medications all the time in my clinical practice for weight management and treatment for type 2 diabetes. In this video, I'll talk about the most common fears and misconceptions about GLP-1 medications that I hear from my patients. Let's go through each one in detail together, separate myths from facts, and look at what the science actually says, so you can make an informed, confident decision under the medical guidance of your weight loss doctor. Let's just pause and leave a comment below. What fears or concerns did you have before starting GLP-1 medications? Or if you are considering GLP-1 medications, what fears or concerns are on your mind? Put it in the comments as I read all the comments and respond to them as well. Let's start with a quick reminder. What are GLP-1 GIP medications? GLP-1 stands for glucagon-like peptide 1, a natural hormone your body makes after eating. It helps your brain give feeling of fullness, slows digestion, and stabilizes blood sugar. GIP stands for glucose-dependent insulinotropic polypeptide. It's another natural hormone like GLP-1 that's released by your gut after you eat. GIP helps your body to release insulin when your blood sugar rises, reduces how much sugar your liver makes, and supports fat metabolism. GLP-1 GIP medications mimic these natural hormones. Common examples are semaglutide with brand name Ozempic for type 2 diabetes and Wegovy for weight loss, and tirzepatide with brand name Mounjaro for type 2 diabetes and Zepbound for weight loss. Clinical evidence proves the weight loss benefit of GLP-1 GIP medications. The STEP 1 trial published in New England Journal of Medicine in 2021 showed that participants on semaglutide lost about 15% of their body weight compared to 2.4% in the placebo group. So yes, GLP-1 medications work, but the journey isn't without questions or fears. Let's tackle them one by one. Let's talk about the 7 biggest GLP-1 fears. Fear number 1 is I'm scared of the injection. So the myth is GLP-1 medication injections are painful and complicated, while the fact is the injection is tiny and goes just under the skin, usually once a week. Most people say it feels like a small pinch or even nothing at all. GLP-1 medication pens are pre-filled and easy to use. You can inject these subcutaneously, which means under the skin in your thighs, abdominal wall, or upper arm. Try icing the area for a few seconds before injecting or doing it right after a shower when your skin is relaxed. The Zepbound injections do come in vial form as well. You have to draw the medicine from the vial in a syringe and then inject. However, the injection needle is tiny and the process is simple. I always tell patients to spend some time at the pharmacy when they pick up their first GLP-1 medication injection. And your pharmacist can provide education on self-injection. You can also bring your GLP-1 medication injection to your doctor's office and have a nurse sit down with you to teach self-injection. Let's talk about fear number 2. GLP-1 medications cause terrible nausea and vomiting. The fact is, mild nausea is common at the start of GLP-1 medication, but it usually improves after a few weeks as your body adjusts to the GLP-1 medication. In the STEP trials, up to 44% of participants had some nausea, but fewer than 5% had to stop the medication because of it. So, what are the do's to tackle nausea and vomiting? Eat smaller meals, avoid greasy or heavy foods, and stay well hydrated. Don'ts are don't rush to a higher dose too quickly, as quick titration can worsen side effects. Don't skip meals and then overeat later, as this can worsen side effects, especially nausea, vomiting, and bloating. Fear number three is I lose too much muscle on GLP-1 medications. The fact is, some lean muscle mass loss happens with any weight loss. Whether you lose weight using lifestyle methods or medications like GLP-1 medications, or even after weight loss surgery. However, muscle loss is not extreme if managed well. So, what helps prevent muscle loss? Number one, protein intake. The main goal of eating enough protein during weight loss is to preserve lean muscle mass while your body burns fat. When you lose weight, especially with calorie restriction or appetite suppressing medications, your body may also break down muscle for energy. Adequate protein helps protect your muscle tissue, supports metabolism, and improves satiety, which means you feel full longer and maintain your results better. So, what is recommended protein intake? Most clinical guidelines suggest aiming for around 1.2 to 1.6 grams of protein per kilogram of body weight per day, or roughly 30 to 35 grams of high quality protein per meal. High protein diet helps maintain muscle and promotes fat loss during both diet and medication assisted weight loss. Second, non negotiable to prevent muscle loss is strength training. Strength training 2 to 3 times per week helps preserve muscle mass. So, a combination of high protein diet and strength training can help minimize muscle loss during your weight loss journey. Fear number four is I'll get loose or sagging skin with GLP-1 medication weight loss. The fact is, rapid weight loss can lead to loose skin, but the degree varies by age, genetics, and how much weight you lose. Let's talk about tips to prevent skin sagging. These are stay well hydrated, strength training to tone the underlying muscle, and gradual weight loss is gentler on the skin. Fear number five, I've heard people lose their hair on GLP-1 medications. Fact is, temporary hair shedding can occur after rapid weight loss, but it's usually not caused by the GLP-1 medication itself. Hair thinning and shedding happens due to the rapid and significant weight loss. It doesn't matter if you lose weight by lifestyle changes or weight loss medications or even with bariatric surgery. Hair loss is related to stress on the body from fast fat loss or low protein intake. What helps with hair loss is to eat enough protein and consider multivitamins and supplements to fill any gaps in your nutrition. Hair typically regrow within months as your weight loss slows and stabilizes. Fear number six is I'll gain all the weight back if I stop GLP-1 medication. Fact is, some weight regain is very likely, but it is manageable with ongoing healthy lifestyle habits. In the Step 1 extension study, participants regained about two-thirds of their lost weight within a year of stopping semaglutide. This shows that the GLP-1 medications help while you're on it, but long-term habits like healthy nutrition, exercise, and mindset are what sustains results. Fear number seven is GLP-1 medications are not safe. Fact is, GLP-1 medications are among the most studied metabolic drugs ever. They've shown dramatic health benefits, dramatic weight loss, and also cardiovascular benefits, and significant improvement in metabolic markers like blood pressure, blood sugar, and bad cholesterol. I have a video regarding GLP-1 medications benefits beyond weight loss. You should be able to find it in my channel playlist called GLP-1 Weight Loss Guide. GLP-1 medication safety is well established. However, these medications are not for everyone. Avoid GLP-1 medications if you have personal or family history of medullary thyroid cancer or MEN2. MEN2 is short form for multiple endocrine neoplasia 2, which is a rare inherited disorder with thyroid, parathyroid, and adrenal gland tumors. You should also avoid GLP-1 medications if you have history of pancreatitis or pancreatic inflammation or severe gastrointestinal disorders like gastroparesis or stomach paralysis. It's best to always talk to your doctor about risks versus benefits of GLP-1 medications. Let's talk about do's and don'ts for a successful GLP-1 weight loss journey. Do's are start low and go slow with the dosing. Track your symptoms weekly. Pair medications with healthy nutrition and strength training and regular follow up with your weight loss doctor. Don'ts are don't expect overnight results. Don't rush the dose. Don't compare your progress to others and don't skip medical supervision. So, what are the questions to ask your doctor about GLP-1 medications before you start? Am I a good candidate for GLP-1 medications? How should I start and increase my dose safely? What labs will you monitor and how often? What are early warning signs of a serious side effect? How long should I plan to be on this medicine? What's the long-term strategy after weight loss? I have general information and responses to most of these questions in my GLP-1 weight loss guide playlist in my channel. So, what are GLP-1 risks to be aware of? Gastrointestinal side effects like nausea, vomiting, constipation are common. Gallbladder disease or gallstones, pancreatitis or pancreatic inflammation is a rare but serious side effect. Thyroid tumor risk in those with MEN2 or medullary thyroid cancer history. Dehydration. So always report persistent abdominal pain, vomiting, signs of dehydration, or neck swelling to your doctor immediately. Fears and concerns are normal, especially when it comes to something new. But the truth is, most of these GLP-1 medication fears are manageable, and many are based on misunderstanding or misinformation, or sometimes lack of training for those who are prescribing GLP-1 medications without due diligence and patient counseling. So, best to seek advice from a doctor who specializes in treating obesity and is trained and well versed with GLP-1 medications. When used correctly with medical guidance and healthy lifestyle support, GLP-1 medications can be powerful allies in reclaiming your health. If this video helped you feel more confident, please hit like, share it with someone considering GLP-1 medications, and subscribe for more evidence-based weight loss insight. Stay happy, healthy, and well. Bye for now.